Hey, welcome to the channel. We hope that you enjoy today's stories and check out the chapters on the video to see all the stories for today. But before we get into this video, subscribe to the channel and hit that bell icon to get notified when we release a new video. So let's get into the video.
Surgeons and doctors of Reddit, what's the dumbest thing patients have lied about?
Experience 1. A woman comes to emerge with complaints of vaginal discharge and discomfort. A pelvic exam initially reveals a significant yeast infection, but there appears to be a foreign body in her midsection.
Is there something stuck inside?
No, I don't know what's in there.
Speculum examination reveals a very soft mandarin orange, peel still on.
Oh, that. We heard it would improve our fertility.
You can't make this crap up. Experience 2. Not a doctor, but in patient care, nonetheless. 1. Guy comes in, between 17 to 19 years old, 4 pebble hits dick. Pretty odd. He says he was doing yard work when the tool knocked a pebble into his dick. He went to check it, and now it was making pus. The nurse clarified that he was wearing pants. Denies sexual history. He stands by that he got hit on his dick by a rock through his pants, which made him produce pus. He had chlamydia. 2. Guy says he was forced to do meth, or something similar, at a store. Came in because he thought he was dying. 3. A fun bonus, a frequent flyer comes in for his stomach hurting from eating this chili he had. While continuing to eat said chili in the lobby. Edit, I have a few funny other stories that I'm just going to add for the fun of it. 1. A woman comes in after doing crack and states now she feels sad. That's all we got. 2. An older woman who OD'd on something says she thinks her son poisoned her with whom she hasn't had contact with in years. 3. An old man with various infections, but his pubic hair was green. We still do not know why. 4. The guy came in for vomiting on Thanksgiving because he ate too much, but it was really tasty. No other complaints and feel fine now. 5. Addict left AMA because he had to go to meth right now. He was in for other issues but had to leave immediately to do more meth. He eventually came back for treatment, thankfully. 6. A minor comes in for poisoning. Turns out, she had food in the microwave, sprayed said food in microwave with roach poisoning, then ate said food and vomited. Now, comes into the ER on Thursday, events happened Sunday, because she was having contractions. Edit for clarity LOL, she was also 27 weeks pregnant. And eating roach poisoning. Experience 3. Do you have any medical problems?
No.
So, no diabetes?
No diabetes.
What medications are you taking?
Metformin. For my diabetes.
I facepalm every time. Sir, do you have any heart trouble?
No.
What medications do you take? Lists 3 different cardiac meds. So, you do have heart trouble. Looks at us like we're dumb.
No. I take meds for it.
Experience 4. Adherence to medical treatment when I have literally pulled their pharmacy records and know they haven't picked up their medications in over a year. Experience 5. Guy came in for a wound on his lower leg that he said came from a biking accident. An X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Experience 6. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's BS from their tone. Patient in for a routine colonoscopy, asked if solids consumed in 24 hours prior. Patient confirms no. In the process of procedure, several dozen kernels of corn are discovered in the colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior to visit. Experience 7. One dude lied about being paralyzed after a lumbar puncture. I got a call from a nurse patient who said he couldn't move his legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure but agreed with my plan to get an urgent MRI. I go to examine him and the nurse says she thinks he moved one of his feet. Next thing I know he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dilaudid. I tell him no because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the 4 narcotics. Also, the MRI was normal. Experience 8. One of my favorite things I wrote during my first year out of medical school. Please note, patient has stated multiple times that he wants to leave and would leave AMA against medical advice. He asked multiple times whether he could eat and stated he was hungry. Explained to the patient that we would like to start a full liquid diet first and if he tolerated it well, would transition to regular foods. However, point ordered Chinese food delivery instead. Then, the patient was complaining of a headache. Was given Tylenol for the headache. The patient stated that this did not help him. His sister at the bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give the patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Experience 9. It's not so much a patient lie as it is me being dumb, inexperienced, and uncomfortable asking necessary questions. I had a hypothetical patient during residency who was a very manly veteran, and I was admitting him for rectal bleeding. He was at the age where it was more than likely colon cancer, so I didn't think it was necessary to ask for a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking.
Do you have intercourse with men, women, or both?
It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, "Son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it." That's when the bleeding started. It was a very important lesson for me. Experience 10. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave a report to the MD, and when I walked back in with the doctor, she looked at me and said,
I didn't think you'd be coming back in the room.
And then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. Experience 11. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts. From light bulbs to hairbrushes to golf shoes. And at first, it's hilarious. Then after a year or so, it's not funny because you've seen way too many distended buttholes. Then after a decade or so, it starts to get funny again because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing and he slipped in the locker room and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Experience 12. Dick modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his dick and it was split/bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case, called urology consult for infection/abscess evaluation.
Do you like listening to these stories? Do you want to hear more of them? Then click that like button, subscribe to the channel and hit that notification bell. And check the description for links to more videos and interesting stories.
Experience 13. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often, it'll turn out positive and suddenly surprise Pikachu's face. Edit, lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons, so they don't rush into surgeries that end poorly. Experience 14. I had a patient that lied about having a job. I asked because he had hepatitis A and I wanted to know if he needed a medical leave. He denied it even though I asked twice. The next day, he came back because he was going to get fired if he didn't provide a doctor's note. ETA, some clarification. 1. I'm in Venezuela, he wouldn't have had to pay anything for that visit regardless of his employment status. 2. He isn't an undocumented immigrant. It's a very small community where everyone knows each other, and he has lived there his whole life and many of his relatives have also been my patients. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. 3. He said that he didn't have a job, he didn't say that he didn't need a medical. 4. I asked what he did for work on his second visit, but I can't remember what he told me. 5. There really isn't a whole lot of stigmata around Hep A around here, even if you work handling food. People just sort of feel sorry for the person and tell them to not eat yellow things. So, I don't think it was because he was afraid of being shamed/reprimanded because of it, but I could be wrong. 6. I'm obligated to report viral hepatitis cases to the health ministry, so they make sure there isn't an outbreak, and I told him this. So, he knew that it was going to be a reporter either way. Experience 15. Their identity. Insurance fraud using a friend or relative's insurance card. As a resident in a very large East Coast hospital, I was tasked to figure things out when the blood bank called and said their blood type changed. When confronted with getting the wrong blood that may kill them, they almost always tell the truth. This type of fraud has also resulted in people who have been dead and autopsied, rising from the dead and appearing in a clinic or ER. Experience 16. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient who was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said the old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we made so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man who didn't have much contact with his family anymore, but mostly because his family didn't reach out to him at any given time, even though everyone lived close by. In his desperation, sustaining dangerous high blood pressure was the best way he had to obtain human contact during the emergency every week. This was the oddest one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness brings to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Experience 17. Medical school student. Not a big deal, but a patient lied to me about what she had eaten. She was obviously having some problems with her gallbladder. Typically, this pain can be caused by greasy food. So, I asked the patient what she had eaten before she got this pain. The patient said she only ate a salad with very little ranch, that's it. I even explained how greasy food can cause this pain, but she's adamant she only ate a salad. Anyway, I report back to my attending, and we see her together. The attending asked her what she ate. The patient said salad, then added she also ate a burger. It wouldn't have changed the plan, but why lie? Experience 18. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin, covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look, and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. The urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency midsection surgery. Experience 19. Honestly, the dumbest lies are the ones people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you, and if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital. So be honest, I truly don't care how much you drink or use, I just don't want you to get worse for something we can plan for and prevent. Experience 20. A 13-year-old girl went to the ER to have a baby and said she didn't know she was pregnant and that she didn't have intercourse. Mom was wondering why she was always wearing hoodies. I was like,
Okay then, keep your secrets.
and informed authorities to investigate. Apparently, the girl had a boyfriend her age and they just were really horny. She came back another 2 times to deliver babies, at 17 and 21 years old. The same dad apparently working his ass off. She then opted for tube ligation. Eventually became a nurse. Experience 21. Sorta the opposite, but I have an ankle that I've sprained quite badly twice. After years of PT, I managed to rehab it back to full strength, but I never recovered my full range of motion. It's close. Years later, I was playing football in the snow with a bunch of teenagers. One of them tackled me and it went the other way, opposite of the prior sprains, and broke. I hobbled back to the cabin and went to the ER the next day. They referred me to a specialist a week later. I gave this guy dates and times for the previous injuries and the one I had at the time. I was as specific as possible, and he went all doctor. House on me told me he didn't have time to be lied to and stormed out. It was freaking weird. I got in to see another specialist and gave him my history. He helped me build it back, and after another year of PT, it's as strong as it ever was, still about 90% range of motion. I never understood why that first doctor was so sure I was lying. I imagine it was because of the buildup of scar tissue and bone. Even now, it's visibly larger than my other ankle.
We hope you enjoyed listening to today's stories. If you want to see more stories, check out these videos or check the links in the description for more videos. And don't forget to like the video and subscribe to the channel. And ring that notification bell.